Good evening, everyone, and welcome to Naveda Wellness's talk series, Life During the Pandemic. I hope all of you are enjoying your Sunday evening. I am Veena Dansingani, founder, director, and alopecia hair loss specialist of Naveda Integral Wellness Center in Hong Kong, which is the first value based integral wellness center offering a transformative health experience to its clients. So, Naveda empowers people to learn the functions of the body, mind, and spirit and provides solutions for all using an integral wellness approach, addressing human, planet, and social health. Also, we empower, inspire, and educate the community to become conscious consumers. Today, we have organized a special Q&A session for the Hong Kong community as we are aware that more than half of Hong Kong's population has been infected by the Omicron virus and lots of people's mental and physical wellness has been impacted due to a variety of reasons, especially during this fifth wave in Hong Kong. So we are very, very happy to have invited an expert who is Dr. Sanjay Nagarkar. He's a PhD microbial ecologist from the University of Hong Kong who will be answering important questions of what kind of prevention precautions one must take to prevent any future health complications. We also have with us two panel guests, speakers who are Mr. Manohar Chuk, a very well-known gentleman in the Hong Kong Indian community, and he takes up many leadership roles in the Indian Chambers of Commerce, amongst many others, to serve and to give back. We also have Mr. Gary Punjabi, who is a well-established businessman in Hong Kong and has been here for over 37 years and is very, very forthcoming when it comes to serving the community for the good. And of course, we have amongst us Mr. Lal Darenani, who is Naveda's director, been in Hong Kong for over 50 years and positively keeps an open mind and ear when discussing about health and wealth. I guess that's one of his secrets to keep him evergreen and ever youthful. So welcome everyone. Thank you. Yes, so how is everybody? How's everybody? We can have before Dr. Sanjay comes in, we can have sort of a discussion amongst ourselves. And those, all of you who have joined us, I would kindly request you to kindly engage in this conversation and discussion, open up the videos and, have your thoughts and your views put forward so that we can actually then have a proper conversation with Dr. Sanjay and ask him the right questions. So, yes, Mr. Manoj, tell us, you're very much in part of the community. You're very much out there. What is actually going on with people's, with people? How are people feeling these days?
Before I speak, let me thank you for inviting me as one of the panelists. And also I thank the Lal, the Danani, and the Dr. Sanjay for your continuous community by bringing the awareness on a different health subject. And this is not the first seminar you are organizing it. You organized many seminars before. And people appreciate your community work. And I thank all of you. Now, coming what I see in the Hong Kong, of course, situations are before was a bad, now seems to be worse on different levels. If you ask for a business level, is different, and then if you look at private level, is different. Now, business level, before people, when we used to meet, we used to say, "How's the business?" But now it's no more. We say, "How's your health?" Because the health has become a priority for all. And even if they are not infected, but one of their relatives or one of the friends or some family members infected, that affect not only the person, but complete family. People who are traveling for a business, they are having a great, great problem. First thing, there's a lot of restrictions on which flight can come to Hong Kong, which flight cannot come to Hong Kong. And even if they have a triple vaccination and negative certificate, still they had before 21 days, and now they're reduced to 14 days, which is frightening for them. So that has affected the business people. A lot of small businesses, like let's say beauty salon, as you said, or even traveling agencies, small retailers, where there's massage parlor, salon, or whatever is there. Everybody's suffering it. And this suffering is not purely financial, but mentally also. And government releases every day figures how many people are infected, there are how many deaths, but nobody releases the figures how many so-called semi-dead. Semi-dead in the sense their business is closed, some people have gone bankrupt, totally distorted unemployment. All those kinds I consider as semi-dead, but those figures are never released. And that is a lot, big amount, than the even maybe infection, I do not know, mental infection. So the government is not doing a correct job, I would say. Now, Carrie Lam has already clearly accepted the fact that it has been fully recognized fact. The vaccination is one single effective means to reduce the spreading of virus. She has accepted this fact. The vaccination is the main factor. Now, government have a lot of powers to close down the bars, close down this, close down the sports facilities, close that this, everything. They have a lot of powers, but they are not using the powers correctly. What they should have done it a year ago, more than a year ago, they should have made first dose of vaccination compulsory. Instead of making this compulsory, restricting this shops open and shop closed, social distancing, all this. Main thing is a vaccination. They should made a compulsory first dose of vaccination. And after that, because vaccination is 7.5 million people, it may not be done overnight. So giving them some time to do it. And after the time is over, they should have given another sort of not advise, actually like forcing them what they have done, like forcing the shops. They don't ask the shops, shall we close or not? They just close it. So they should have given for second dose also. Now, most of the people who are infected are people who don't have two doses. Now, it's not a fair system. People who follow the government and have a discipline, they go and have two doses of vaccination. They are actually innocent people. The culprits are who has not done the vaccination. So because of culprits, which who has not done double vaccination, innocent people are suffering, and that is a big loss. So government should have right policies. I think so. The policy is not correct. I think so. I have many other things to do, but I think so. I have things to say, but I don't want to take all the questions. I have a lot of questions, even
Sure,
for doctors.
sure. We'll get
Yes.
to the questions. Let's just get
Yeah,
a feel of.
now let I speak other guests, and then I'll come back again.
Sure, sure, sure. Thank you, Mr. Manohar, for sharing your viewpoint.
Yeah.
Mr. Gary, how are you doing?
Yes, Veena, thank you very much for inviting me as a panelist.
Yes, yes,
It's really nice
wonderful.
to see you all and see Mr. Manohar and listening his comments. It's really helpful to every one of us. Yeah, thank you so
Yes.
much.
So would like to find out from you also, like, what's the general sort of feeling that your family, your friends, your community of people that you're surrounded by, how are people feeling? What are their thoughts? What's the general concern out there?
Well, for me, what I have seen and what I advise people not to panic. This is very important. We must feel, I mean, safe. We are living in a safe environment in Hong Kong. It's one of the best country I can say still to live in. And of course, government is doing their best to protect us. And whatever, of course, no country, is perfect today to take care of every citizen to the level what each individual want. So I think here is very important that what is our part, what we are supposed to do. The problem is we don't take care of things which we must take care, but we keep blaming others and keep finding, there's problems in others. So what I feel for this, is this disturbing for me?
Yeah,
Yeah, there must
coming
be
from
two.
there must be two devices.
You know? one device on. I don't know. Hello.
It's saying Savita. Who is Savita here?
I think like your both the devices are very close to each other.
No,
Can
I
you-
got only Dr. Sanjay. Good evening.
Oh,
I got
you
only
have
one
to-
device.
Oh, okay. All right. So Savita need to mute. Yeah, I believe so. Or someone else also, like maybe, so mute everyone.
Yeah, so everyone is muted at the moment. Yeah, go ahead, Gary.
So what, as I was saying, the very important is that what is our duty, what we are supposed to do. So at this level, the first like few points I note down, that we should take good care of our personal hygiene, and we must keep connected with the friends, with family. This is not the time to keep differences and think only for yourself. God has given you a lot of wealth in Hong Kong people, and from the many different kind of things. So you should use your sources, your powers, your money, whatever way you can help people. You should go around. You should meet people who are in trouble. We know many families are in problem today because of the businesses suffering, because of the health issues, and we generally I see people close their eyes, they turn and just think for their own life. So what I feel that no matter what we can do, but a bit of it we should go out and help people and keep connected. So that can also help society and also our own family, and it's a blessing, of course. And the third point, as I said, the first one, we should not panic. Even we are COVID positive or anything, you're not going to die. Everybody is not going to die. As you said, the Hong Kong is almost half infected now. So what we should do, we must understand, we should follow the government guideline, and go to the hospital or go to the private doctor. Now even hospitals are not pressing you or pushing you to, you must go and admit in the, in the hospital. The problem is we are too much listening and seeing media, and there are so much of negative effect from the media. So we should avoid from the media not to read any negative news. And especially when you're not sure, you never forward to anybody. The problem is the good things we will just not even enjoy. We will not digest. We will just keep silent. But for the worst thing, or the the, like, we want to become superstar. Oh, so many people died. This road accident happened. So many people got sick. Oh, so many today, 60,000 cases, and we share to all our friends immediately. This is, we are not doing good thing. This is, we are making other people also going crazy, and this makes society suffering too much. So this is what I mean. And then the fourth point is, we should not make things which are not necessary at the moment. For example, traveling, going to eat outside, family, this friends gathering, like Holi, people are still gathering. Birthdays, people are still celebrating at restaurants. We see a lot of pictures on Facebook. So we must, keep some guideline, follow what government is saying, and we have common sense. We should use our intelligence to understand what is right now. The problem is we are the best teacher, but we are not the best student. We never listen people. We only keep guiding people. Hey, come on, we are getting crazy. Let's go out. Let's meet tonight. Nobody's going to see. No problem. If somebody come, we'll do this. We'll no. You should please be nice and help society, help yourself, to make things easy. Hong Kong is still think. See, if you're alive, if you're good health, you have a lot of time to enjoy whole life later. But if you, in the wrong time, if you are pouring more kerosene and petrol in the problem, don't forget that if the fire increase, you're also going to be burned there. So better take good care of these things. Don't travel unnecessarily. Don't do things which are not necessary.
Right. So you're basically noticing that there are a lot of people still sort of like not kind of following government guidelines. So they're still doing their own things. They're putting a blind eye to a lot of things and not really caring further for the society or for their families and stuff, but they're just thinking for themselves, right? And so really, what are the real precaution and prevention measures? And one should really listen to the experts. And even the government is really trying to do its best and is getting a lot of guidelines from the experts themselves. So as we know that today we have invited Dr. Sanjay Nagarkar, who I've already introduced in the beginning, who he is, and he is our expert. He is going to be, we have this opportunity. We've actually organized this session. It's a Q&A session for all of the Hong Kong community to actually ask an expert who is an expert in this field. Because what we have realized is that suddenly it always happens. Suddenly, so many experts come in the market and they're not real experts. They're mainly business people who are trying to sort of make an extra buck here and there, but not really understanding what are they truly guiding people with the right knowledge? People are just out there taking advantages here, left, right, and center. But we really need to follow and listen to the experts who are experts in this field and see what they have to share with us and guide us, and then follow accordingly. So we have with us Dr. Sanjay, and Dr. Sanjay, can you hear us?
Yes, I can hear. Thanks.
Yes. So thank you so much for coming here, time again and again. I think we have been doing this since the beginning of COVID, since 2020, January. In fact, we started educating the public, making sure that people are aware of what the precaution measures are, what is COVID. And Dr. Sanjay has very tirelessly put his efforts to be out there, serving the community, educating us. And he's not surprised that Hong Kong is where it is right now. In fact, he predicted it this much earlier. In fact, when from the beginning of our seminars, he already mentioned this, and people didn't listen. So, anyways, here's an opportunity for us to ask the expert himself, uh, you know, the questions, the pressing questions, people who are confused about precautions, preventions, what should be done, what should not be done, because a lot of things are that people are doing, and they're going to be major health implications in the future if people don't follow consciously. So, welcome, Dr. Sanjay. Would you like to share a few words before we open it to the public to ask the questions?
Thanks, Veena. Thanks, everyone. I know a couple of people for quite some time. Like, thanks, Manohar. Manohar is following and joining and very curious. So, thank you, Manohar, very much. You put a very valid point. I heard you very clearly, and it makes sense what you're talking. I heard Gary, you like is very interesting, and I think like one of the beautiful thing I keep saying for last 2 years, like be a responsible citizen. And any person, those who are acting as a responsible citizen, they have contributed a lot to handle this pandemic. This is not a blame game, right? This is not a blame game. This is a kind of like to correct your act. So today's session is something like that. I'm a microbiologist, and what microbiologists do, our job is very challenging. We deal with something which we cannot see from naked eye. Okay, that is the biggest thing. So like if you see so many people dying, so many things are happening with a invisible virus. That's the challenge. If you can see this virus through your eye, you know where they are traveling. Okay, so say something like a mosquitoes, right? So mosquitoes, like a lot of disease spread through mosquitoes. You can kill mosquitoes and you can avoid the place where the mosquitoes are not going, right? Is not there. But in this case, it's invisible. So we microbiologists deal with invisible organism, and it is divided, especially like in our case, two part. One is a clinical microbiology, and that's what everyone need to understand, and it will help everyone to like really manage themselves very well. One is clinical microbiology and other is the environmental microbiology. I'm an environmental microbiologist, or you can say microbial ecologist. What does that mean? That when virus or bacteria is in the environment, okay, it's like is in the environment traveling from one person to another person. So that's our area of specialization, that we can calculate, we can tell, we can predict, like, and we can create a model that how they are transferring from one person to other person and how they are magnifying or spreading it. Clinical microbiology is when you are already infected with the virus and you are sick and you are in a hospital. So these are the doctors who are treating you. That is the part of the clinical microbiology. Now in a COVID, so the whole question answer will spread is in this way. Like, unfortunately, what happened, like a lot of people came out of their discipline and started talking other discipline. They don't have any idea, and that's where there's a lot of confusion there. So the first part of the confusion is like a different kind of experts. Those who are not expert of environmental microbiology is talking how to spread the COVID. So that's not a correct thing. Second thing is like too much social media, too much social media, talking too much about things. I really like this Gary's point, like say, hey, just have a positive talk. So just a positive talk. More you talk about negative, like it's like the mind go in that particular side. So that will going to cover it out. And third is the media itself, right? So we have a lot of like source of information, and I call it the information overloaded. So today we will try to simplify all the things, and we will make it very simple as 2 plus 2 is equal to 4. So if the people can understand 2 plus 2 is equal to 4, let's achieve this target today, that simplify this corona pandemic in such a way that it everyone can handle it in a very nice way. And just remember this one thing, that one of the hygiene practice is wash your hand. So one thing we have to keep reminding ourselves, that this virus we can kill from the soap. So we are dealing with a virus which we can kill from the soap. How come this virus created such a big panic among us? There's something gone wrong. Okay, so let's talk about that. Yeah.
Wonderful. So thank you for that introduction, Dr. Sanjay. Yes, Mr. Manohar, you have a question to ask. Please unmute yourself. Anya.
Yes, Dr. Sanjay, once again, you after a few minutes. So I have mentioned your name, that thank you for serving the community continuously.
Pleasure.
And this first seminar, you have done your job since long. And I wish you all the best to continue with your good community service. Now, today's main subject was also disinfection.
Mm-hmm.
Also, because when I received circular, and when I received circular from Veena, and I immediately said, yes, I will do that.
Mm-hmm.
Because we were learned always in the school before, prevention is better than cure.
Yes.
It's better to disinfect the places,
mm-hmm.
and then have a peace of mind.
Mm-hmm.
Now, many people have a wrong impression from audience, I think so, that this disinfection has to be done only if there's some positive case in the place of your residence or place of your working office. Now, you can clarify those people that it's not necessary that when you do the disinfection, it must after somebody have COVID, a positive case. You can do it before, as prevention is better than cure. So maybe you can remove your doubts, and you can speak on what is the advantage of a disinfection, even there's no case at the place of the victim or at the office. Thank you.
Okay, thanks, Manohar. This is a very interesting question, and as I mentioned, this pandemic is through the invisible virus, right? So it's an invisible virus, and we have learned a lot in last 2 years. And there's a lot of information. All of you know, like there's a different way this virus is spreading, through surface, through aerosol, through sneezing, through personal contact. So there's many ways this virus is spreading. So question is not about this particular virus. There is a subject which we deal in environmental microbiology, and I personally dealing this more than 20 years. It's called indoor air quality. And indoor air quality has a very specific importance in Hong Kong because we are a vertical city. Most of us in Hong Kong spend a lot of time indoor. So you have to understand, like, the exposure to the fresh air is minimal to the Hong Kong people if we calculate our office hour or how much time we spend inside a house. What is the air purification kind of things is your air con, which is filtering the air and then recycling the air. Indoor air quality is such a big subject where we focus mostly on kitchen. So I'm elaborating this and coming to COVID so people can understand. Many of you have a headache. Many of you have like panic attack. Like many of you like have a bloating. Sometimes like you are lethargic, tired, right? And we say like, okay, this is maybe because I'm like have some problem. But no one understands this can be due to the toxic gases or toxic item releasing from the bacteria and the viruses, those who are living with you inside your home. Okay. So there is a very comprehensive subject which called indoor air quality. With you right now, hundreds and thousands of bacteria and viruses are surviving inside your home. They are releasing different kind of toxics all the time, and we are inhaling them. Second, like in the kitchen, every day we cooking at the home, like people are cooking. Through the cooking, everyone have heard about like the VOC, volatile organic compound. That's like the lot of gases like we are producing through our kitchen, which is like a spreading in our home, which we are inhaling. That's the second point. Third is the type of the furniture and the wooden. Everyone has a wooden structure in their home, and everything with the wooden structure is release a lot of formaldehyde. So there's a lot of formaldehyde and other kind of. So I don't want to go into detail. This is our regular process, and that's what we have to understand. This is a very big subject. Like when we are talking about the dementia or the mental health kind of things, the impure air, indoor air quality play a very significant role to enhance this dementia, enhance like the mental related diseases like the insomnia, panic attack, anxiety, and all those kind of things is there, irrespective of COVID or not COVID. Now, when the COVID came, it added into this the whole situation of indoor air quality. So indoor air quality become like not a kind of a choice. It became a mandatory for every people. Like it's like that. Like you need to clean. You don't need to clean you don't need to kill COVID only, but you need to clean all this toxic environment inside your house. You do not feel this toxic environment because you cannot see them, but you can see them in form of a headache. You see them in form of so many other things, as I explained to you. Now, COVID last 2 years, what we have learned, COVID is not spreading only through air. It is also spreading through surfaces, number one. Second is COVID, the SARS-CoV-2 virus. Previous viruses, they survive mostly 3 to 6 hours out of the body. That is why we are all alive. There are millions of viruses around us which create a lot of serious diseases. But why we are not infected very much? Because the moment the virus needs a particular host, and when the virus go into the air, they cannot survive more than 3 to 6 hours. And when they don't find a host, they die down. In SARS-CoV-2 case, what happened? It is a very unusual case. The virus is surviving out of the body. Different research coming out. Even there is a report like 28 days, 21 days, 17 days. So still information is coming out. So first time what is happening, the virus is supposed to die down within 3 to 6 hours when it is outside in the body, is not dying down. It's staying over there. Therefore, disinfection becomes so important. Why? Because you are going out. Okay, someone is traveling in MTR, someone is traveling even in a private car, doesn't matter, but you are interacting outside. And this virus has a tendency not to infect you directly, but maybe it is lying down on your clothes, or it is like on your surface. It's not infecting or going in your nose and creating a disease directly. Now you come back home, and in your home, you are using that contaminated clothes, contaminated hand, or so many other things. So basically, like every day you are going out, and when you come back home, you are increasing the possibility of bringing this virus to your home every day. So the whole logic is like Hong Kong, like they say almost half of the population is infected by now, or like more than 2-3 million people. Okay. It means like the chance is bringing that virus to your home is very high on a daily basis. So no one can take and say with guarantee that like, oh, we don't have to take like disinfect the home. So in today's case, it became the mandatory it's a mandatory necessary item to disinfect the home. So I think like that can explain to you, Manohar. That will help. Unmute, please.
Yeah, I immediately did it. So I knew what is advantage of having disinfection. So I had no doubt. But for the people who have a doubt why they should do it, they have no positive cases. So I thought maybe you can remove your doubts by explaining to them, which you have done it nicely. So I had no doubts because I am quite happy for doing what I did.
So that's the answer. Like every day, every home at a high risk because people are going out. And as Gary explained that, like if no need to do the unnecessary traveling, unnecessary gathering, because the moment we are doing unnecessary gathering, traveling, we are increasing the chance of bringing that virus to our home, because at the end of the day, we are coming back to the home, right? So that's what it is. So disinfection is very, very important because at this time today, right now, if we say, we have a very high chance of bringing back this virus to our home. Yes, please.
Yeah, no, I think so. You heard what I said earlier before in the starting of the meeting, that the government have a lot of power to impose the restrictions on closing the bars, closing the salon and small establishment, bar, so many things. But they should have used this power to make the vaccination compulsory, because Kerala has accepted the vaccination is the most powerful tool. But they shouldn't do it. And instead of that, people who are not vaccinated, they are spreading the virus. They are the culprits. And people who are following the vaccination procedures of government, they are disciplined, good citizens, they are suffering it. So that is unfair system, you see. The system has to be produced. I know you are one of the medical expert. I do not know how much the government listened to you, because last time I had asked some government advisor on a medical things, questions about the why they had to be 3 weeks for vaccinate this quarantine when you come back because travel is difficult. What was his answer? He said, "I'm a doctor and not a politician." What he was trying to say, the medical team have no value at all. Decision is not made by medical people, experts. Decision is made by the government. So I do not know how much the government is listening to you. Then then you can advise them that vaccination, make it compulsory. They're like they should have a health certificate from the very beginning. People who have no vaccination, they should not be able to travel to MTR or buses or trams or ferries or any public transport at all. So they'll go immediately for vaccination. So they have used the powers in the wrong way. So that was my point earlier before you came,
Yeah, I heard that. And then
Yeah.
see, it's like I say the same thing on a positive way so people can understand. And that every person, every government, every institution should understand it. Expert doesn't mean that they choose to work in a government institution, right? So I give like the parallel example. Someone may be very good singer, but if they are not singing in the Bollywood, you then do not classify them that you cannot sing because you are not chose to sing in a Bollywood, right? So there are so many experts like me who chose not to work with the institution. So this is the thing government has to understand, and everyone has to understand. Expert doesn't mean like the people who work in the institution. There's a large number of the people who doesn't like to work in an institution, right? So it's like a between like doing a business or doing a job. So if you're not doing a job, doesn't mean you are expert, right? You chose to do your own work. So unfortunately, what happened like this, like it's a very straightforward. That's what I'm saying, because I am the expert on microbial ecology, and this is a very strong statement. Microbial ecology expert only understand how the virus are moving in the environment from one person to another person. Whereas the other microbiologists, those who are the expert committee, they are the clinical microbiologists, they are the medical microbiologists. And medical microbiologists only understand when you are infected with the disease, when the virus is inside in your body, right? So there's a big difference. People need to understand, right? So when we have to stop it in the community level, there is a ecology, there's an environmental thing, Now, I don't want to take a name, but like some of the microbiologists from my university, Hong Kong University, is enter and they are the medical doctor and they are going and like looking the sewage pipe and all those kind of things. What a doctor understand about the sewage, what we understand about sewage. So that's a distinction was not made, right? So that's where somewhere is like the lack of understanding, and this is the responsibility of not the government, the responsibility of the expert who should say like, hey, this is not my field of expertise. Let's bring the expertise, those who are like in the field of that. Example, how I can explain, suddenly some health crisis coming and the health crisis is related to the kidney and the government is asking the cardiologist. So cardiologist is not telling the government like, hey, let's bring the nephrologist on board or the neurologist on board. They can tell better about like the kidney problem or the brain problem. Cardiologist said, no, I can handle. And the cardiologist took everything. So cardiologist is misleading the whole information. So here I don't want to blame the government. Like government the government job to understand what is the definition of expert, who understand the subject, right? So this is the thing went wrong in Hong Kong, because like the Hong Kong government, if you see like in the whole media, the 7 million people rely on only 3-4 people of expert very much. That's a very wrong concept. This is like something like very so many people would have contributed into it. Number two, when in 2020 bar were closed, bar industry were the hardest hit because like it was like most strict restriction on the bar. So then I work with the bar people in order to communicate on their behalf to the government. And all the things what you see today, like leave home app, or like we give like a good a practice to the bar people and say like, okay, we committed as a bar owner to the government that I will maintain a good practice, and by which I can control the COVID infection inside my premises. Why? Because long time back, if you remember in 2020, that like some insomnia bar or other the bands were getting infected and all those kind of things. So like that's where the like the bars and other places were closed down. So the idea was that what you were saying, okay, there's a barcode. People are allowed to come in, those who are vaccinated, say for example. So it is a responsibility of the businessman. Businessman should say like, hey, I will not allow any person honestly who is not vaccinated, okay, and I will only allow the people who are vaccinated, kind of thing. So this is a lot of things, these kind of things where community level things has to be done, which is not done on the community level. So as I said, government has done excellent job the way government should do. And as Gary said, this is the global problem. So we have to talk on a positive language kind of thing. So in a positive language, what I'm saying, there's a lot of role of the people involved. So people should do the role by positive thinking, then everything can be solved. So it is not that the government implementing. Say, imagine that like some restaurants say like, hey, this is the restaurant. Think from the business point of view, and it's a very excellent idea. But suppose some restaurant is advertising that we do not allow any person, those who are not vaccinated, in our premises. Suddenly many people will understand, wow, this is a safe place, let's go. His business will increase. One restaurant, other restaurant follow, third restaurant follow. So it's not about the government policy to implement, it's like many of us we can do. So again, going to the Gary's point, like say suppose I take a decision like, hey, I will not meet anyone, okay, or I will not meet anyone who is not vaccinated. I will not play Holi. I didn't play Holi. Like why should we do that? So we take a decision. So be responsible businessmen, be responsible on. I think like this is the thing, Veena. I hope like this is the answer for Manohar. Is let's not blame anyone here. Let's understand, because this is the session for understanding thing. Past is gone. Future, how we can handle it, that's where we need to understand. Am I fair enough?
Yeah, some extent, yes. Some extent, I agree with you.
Yeah.
Anyhow, I think so. There's a restriction of a time, and I see we are moving closer to the time, and other people may not have a chance to speak.
Yes.
So those have questions, I will rest here for a while and let other people ask the questions. And then if there's time.
Sure. Thank you. Mr. Gary, did I understand you've got some questions to ask.
Yes. Good evening, doctor. It's nice meeting you, and thank you for giving me opportunity to meet you and ask you this question.
Pleasure.
Sir, the first one, I really appreciate what Naveda Wellness is doing and with your guidance. And it was really appreciate to Veena that she called me and explained me about the service you are providing, and you're doing a lot of sessions. It's very helpful to everyone. And when I heard this from Naveda, I immediately told her, yes, must do it today only. It is not that we wait, things get worse, and then no, it is precaution. It's better to take precaution rather than, waiting for the things to get worse, and then you have no choice. That time you want to give up everything to get the relax and the things done, but it's not easy. So it's really thank you, Veena, for suggesting. And my house is disinfected now. Disinfection service was done last week, and your staff was wonderful. And your charges are most cheapest, I can say, among what I compared with the other groups. So I really suggest everybody, whoever can, see this program, especially in Hong Kong, the things are very bad now. And for precaution, just think one family dinner you skip and do this disinfection in your house. It is very important for your life, for your house, for your safety. And you should also advise your neighbors, your friends, your people, especially if their anniversary or birthday. I will say rather give them a paid one coupon from Naveda. Okay, I do disinfection in your house, and definitely they are going to appreciate. I feel my house is now so positive after that, the feeling and the way they did this disinfection, it is very helpful. And yes, my question is, after this disinfection, doctor, what you suggest? What are the after any professional advice, like we should do regularly every month, or we should do 1 or 2 times more, or it's okay one time, and what we should follow on this?
Okay.
So I need your professional advice.
Yeah. So the first thing, as I mentioned, like these kind of things I'm doing over 20 years. Okay. So people don't know. But in Hong Kong, there is a law, it's called there's a procedure, it's called the sick building syndrome. So all the big buildings or old buildings, they have a certain kind of problem, and then it has to make sure like they have a clean air, and it's called the indoor air quality, and it's handled by the Department of Environmental Protection Department, okay, in Hong Kong. Now, COVID added, so the indoor air quality become more emphasized as a biological indoor air quality. Okay, so indoor air quality has a two different part. One is like the chemicals, vapors, and other is the germs. So in this scenario, it's like the germs is the main part. So Manohar has done it, you have done it, and I can guarantee you, both of you, like after disinfection, you may have felt the difference in the breathing. Because what happened, like when the air is clean and when you breathe the fresh air, that's what I'm saying, like it's no need to listen to other people and feel yourself. Like when you breathe the fresh air, your body can feel it. Okay, so the cleanliness of the air, so that's there. So what happened here, I was working on a lot of disinfectant for many years. And there is always a challenge to work with the disinfection, because when you do the disinfection, the particles remain in the air and we breathe them. So we have to see two parts. One is obviously the potency. Like suppose like in this case, whether it can kill SARS-CoV-2 virus. That's one of the objective, and other germs. But at the same time, we have to safety of the human being, like you are inhaling. So it is not giving you a instant or in a long term any kind of adverse health effect kind of thing. So this is very important. So what happened, like that, therefore the disinfection from the professional is very important. Why it is very important? Because if the professional person is not doing the disinfection, that person do not have any idea that at what amount they should spray at home, whether this is the amount they are spraying, it's good for your health or not good for your health. They're coming like as a cleaning people, right? Yeah, they're cleaning and they are dying, spraying it, and that, okay, we kill COVID. But what happened with COVID? You also damage my lungs, right? So that is why disinfection is not a cleaning process. It's a very, very technical scientific process and should be done by the professionally trained people. That's number one. Why? Because it's a spray. Then has to be a technology, like how much spray has to be in the air, which should not be inhaled by the people. In the family, there is a different scenario. In some family, there are kids, small kids. Some family, there are senior people over 70 years of age. In some family, there's a pregnant women. In some family, there's a asthmatic people. In some family, there's a people with the heart condition or pre-existing health condition. These all need to consider. So right now it's a very sad light to see, and that is why I said like Veena is doing good job, and like just I want to confirm to anyone like Manohar knows like last 2 years like we are doing community service. We have done so many free awareness campaign and all those kind of things. So this particular part we are not doing to earn money, and we are not a part of those particular group who just go and in cashing the opportunity. I am there for 20 years. I am here. I will there as a regular professional expertise, right? So we want to help the people by educating the people. So what the main message going Gary here is the professional disinfectant person, right? They should know how much volume you should spray at the home. Okay, this is very important because they are carrying the chemical at the end of the day, right? So this is the thing. So professional training. Second thing comes most of the disinfectant. What is the most of, forget about most of that, except the disinfectant we are using, all other disinfectant either chemical based or alcohol based. Okay, so this is the one of the things like because we are doing it for many years, it took us so many years to find out, and we created a very safe disinfectant which you have used your home, Manohar, you're at home. With this disinfectant, actually you can clean your vegetables. So this is our very interesting point, and we want to share with the people. If you can clean your vegetable with disinfectant, you can safely use disinfectant in your home. It's absolutely safe. This is very important. This disinfectant is not made by any kind of chemical, is not alcohol. It is made by 4 different kind of food ingredients. Okay, so this is the technology. I am a scientist. We have created a disinfectant with the food ingredient. So what is the meaning of food ingredient? The ingredient which you can eat, you can easily use at your home, whether they are kids or senior person or anyone. It's absolutely safe. Safety should be more important. Disinfection can be very cheap, very cheap. Someone can do $200 disinfection at your home, but the chemical could be like very dangerous. That's what people need to aware about it, like the what kind of chemical people are using. It's not about the pricing. Like more serious chemical, more harsh chemical, much cheaper is the rate. It's very simple like that. You go to Watson or like Welcome or Manning, Welcome or Parkin Shop, and you go to the detergent section, and you go to like the kind of like acid section, you get like $29-$39 like a big 1 liter things. You dilute it with like, so some the raw cost of disinfectant become how much is $50. In $50 people have that, they are adding another $100 the manpower cost, and you get like 1,000 square feet disinfection, 2,000 square feet disinfection. That is not a disinfection. Okay, that's you are destroying and taking the opportunity. I'm sorry to say that, but it's a very harsh statement, but it's a scientific statement giving explanation that you don't need to do the disinfection. You can buy the spray bottle. You can, if you're not health conscious, go to the parking shop, go to the welcome and buy any kind of detergent over there which has a harsh chemical into it, and spray it, right? Is a zero cost. The portion is the healthy thing. So now coming to your point, now we have done one-time disinfection. If the one-time disinfection is done, it will not remain continuous disinfection at your home. Okay, so what happened, like this is like we have created a most affordable kind of disinfection because this comes as a form of a tablet. we create a tablet, because you don't have to carry the liquid, because it's a bulk. How you can carry a liquid? So this is a kind of a tablet. One tablet you dissolve in either half liter of water or 1 liter of a water. Okay. And then you have like a lot of spray or atomizer on a daily basis, you can spray. Okay. So this tablet may cost you 15, I don't know exactly, I have to check that, the 15 or $20 kind of things. You can run for 3 days or 2 days, and you can keep disinfecting yourself. So we have disinfected your home at one time, and then you can do the self disinfection by the same kind of things, by very simple. So I calculated by like 400 or 500 Hong Kong dollar, you can keep disinfecting your house every day. Okay, so we call it a dynamic disinfection. So first we have come and we have cleaned your home like professionally by looking at where it has to be clean. And then you can have these tablets, which is a disinfectant, dissolve it in a liquid, 1 liter liquid, and then put in kind of a spray. And then this spray can be very easily done. Hold on a second, let me show you something which I'm using at my home, so you will get a very good idea. 1 second, please. See, this is the thing. You can see that this is the very small bottle, and we put this liquid into a 1 liter and then fill this one. This is a little bit yellow in color. And then when you spray like that, like very easily you can spray the whole thing around it. So easy. And you can see that I put on my face like that, nothing. So that's the thing. No chemical disinfectant you can. So you can say, this is my scientific discovery. No chemical you can put like on your face like that, but I'm doing it and very nicely like that because it's made from food. So a scientist is doing in front of you what else you need, right? So that's what it is. It's all about safety. It's about safety. So, and the cost effective. So why cost effective? Because we have to see there are so many, it's a pandemic. And there are so many people, we need to provide them a hygiene and good. There's a lot of small homes in Hong Kong, 400 square feet homes, 500 square feet home. So one-time disinfection will not work. We have to give them the continuous disinfection. And this is like the way I'm using, all of you can use in the same way. It's a very cost effective. Every day your house is clean. You don't have to worry about. And when you come back from like outside, that's what it is. Like you just spray on your body like that and you just clean. That's what it is, like that.
Yeah.
So Gary, conclusion here is, this is a very amazing technology. Is made by the food ingredient. Okay, it's not a chemical, but it's a chemical, but made by the food ingredient, which is absolutely safe in the concentration what we use.
Yeah.
And then you can do every day.
Really appreciate, doctor, for your advice. And yeah, this is what Veena, I checked with her, that if we are doing, is it safe? We can stay home. She said, no need to worry, stay home. And I didn't feel any smell or any problem. In fact, like you sprayed, I was enjoying that time when they were spraying in front of me. Even I was like not worried when she told me it's a fruit ingredients.
Yeah.
So this is really safe. And she told me even you have paid, because my friend, they got one pet and they got somebody got pregnant baby, small babies. They said no need to worry. You can stay home. It is very safe. So this was really good advice. Really
Yeah.
appreciate, sir.
And actually, like every day when you are going out and when you come home, like you can keep this like with you, and it's okay. This particular chemical disinfect or inactivate SARS-CoV-2 virus. Now it's proved by research, and so many other viruses within 1 minute, within 60 seconds. So that's the like efficiency. So two part: efficiency and safety. That's it. And third is the cost effective. That's it.
Wonderful.
What else people?
I have a question. I mean, there are a lot of people have been talking to me. They call me and stuff, and they go like, "Oh, I can get it much cheaper outside." And when I really want to empower the community that when you get professional service, get it from people who are very much experienced in this field, and also ask for certificates or ask for what these companies are putting in their disinfectants, because when I see it, it's full of chemicals and I feel so sorry for the people who've actually just used it as the cheapest way to get something disinfectant, but they've actually poisoned their health for long term. So my request is to really be careful about these things.
Yeah, one of the things, like as Veena mentioned, one of my seminar is very popular. It's related to the food safety. The title of the seminar is, Are you eating safe? And when you say yes, my second question to you is, how safe is your safe food? So basically, these days, we have to learn about food safety a lot, product safety a lot, because what happened, like, say, food poisoning. Poison means like you get an immediate effect, okay? But what is the meaning of toxins? Toxins means it affect you slowly. Like if you exposed to certain things today, maybe something happened to you 2 years later, not today. So you will not remember that 2 years back what you have done. So these are the things, like more and more scientific solutions. So let's put in this way: disinfection is not a grocery item. Disinfection is not a trade item. It's a very, very professional scientific procedure, has to be done by the professionals in by the professional understanding. So this is my message to the people, those who are going to the disinfection service. Make sure that some professionals are coming to their home, doing in a professional way. Ask them some technical question. You understand that, like whether they understand those technical, able to answer those technical question. If they don't able to answer the technical question, it means like the product they are using, they don't know what they are using. So when they cannot take their guarantee, how they can guarantee you? So basically, this is the what we call the consumer responsibility. Consumer responsibility means you know what you eat, you know what you apply. It is your choice at the end of the day, and you have rights to know. Basically, it goes in that way.
Wonderful. Is there anybody else who would like to ask a question? I'll just open it to the floor. If
Poonamji,
Poonam,
Poonamji is there.
Hi,
yes.
everyone. I simply enjoyed the conversation and discussion by both the speakers. And I just want to cap that I do agree that we have to be very positive, avoid the media. Don't keep thinking about every morning how many cases are come and gone. But at the same time, I want to say that few of my friends who got injected, who have not been out and they stayed home, they had some cough and 3 of them passed away. So I don't know how to explain. I must say death is inevitable. You have come in this world, you will go, irrespective of the age. I know a person who's 97 years old who got COVID and has come out. And I've known a person who's 36 years old and he went to the hospital, he never came back. My own sister didn't come back. So we do not know why people are dying. Is it for COVID, personal health, or is God's plan for them? So Mr. Gary rightly said, you don't have to worry so much, think positively, and keep company of positive people. If you ask me every day in the morning, I only have my positive messages going, coming, meeting people. And when we are at dinner, particularly, or lunch, anywhere, I just tell them, you come here to eat. You're spending your own money, or you come to your house, please eat without thinking of all negative. On the dining table, we are talking how many cases came, how many. I said, don't do it. Just don't do it. Just stop it. Enjoy your meal, whether you're 2 people or 3 people in the house. And everybody rightly said, be responsible. And we are not little kids. We are not stupid. We have to be responsible. What government is doing, they are doing their best.
Hmm.
And we are in a place where we have enjoyed every moment. When there was no COVID here, we say, ha, 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 Hong Kong is the best. But because now we are in a different situation, we cannot play blame game. All your points, don't play blame game. If you're preaching, please practice. Hygiene is very important. And today I also learned that disinfectant that you are providing, Naveda is providing. I'm very proud of you, the whole team. And I will spread the word around, and my house will be the next one with rest of my family. So thank you very much. And Mr. Manohar, Mr. Gary, and Mr. Sanjay, Mr. Lal, you've been very quiet. Lovely meeting you all, and thank you, Veena.
Thank you, Auntie. Thank you.
Poonamji, I want to add like one thing to your talk. Like what happened like last 2 years, we are learning a lot. So this is a new virus, and people slowly are learning. And what happened like always, as you said, like whenever something happened in the large scale, uh, 10 to 20% people show different kind of reaction. So in COVID, we are learning that many people are having a blood clotting, many people are having so many things, like new research is coming up. So I would say like the person, those who are not able to make it, those who are young and all, these are like some kind of like a unfortunate human being, like those who are like carrying certain kind of different biological makeup and not able to cope up with the standard operating procedure of COVID, right? So it's a news coming from all over the world, and that is why this in a disinfection I'm making these things very profoundly, that the people with the pre-existing health condition. Now there's a two definition of pre-existing health condition. One is you know about your pre-existing health condition, and second, you don't know about your pre-existing health condition, right? So many people, like say very young people, are dying, right? And we say, oh, they're fine, they're dying. But for us, technically, scientifically, they may have certain pre-existing health condition which they don't know,
Yes, I
right?
agree.
They don't know. And so that's a one group. The second group is the people, those who have a pre-existing health condition, they know. So this is my message and my request to all the people, a sincere people, please take care of children, please take care of the elderly people at home, and please take care of all the people, those who have a pre-health condition, especially with the people with the hypertension, diabetes, a heart problem, mental problem, and asthma. Like we are missing out one of the very big thing which never people talk about. There are so many asthmatic people in Hong Kong, right?
Yes.
So we need to take care. So this is my appeal and request. Like please spread the word and request them to take care of the people. And as I say, like in collectively we all talk about, and my bottom line is be a responsible citizen, be a caring citizen, talk positive, be positive, and looking at the current data, what we see, like what is happening in last 5-10 days, I can say like, okay, we can see the light at the end of the tunnel. Like, so things are like, will be better very soon.
Thank you very much. But don't you think that we are all, most of us are living in fear?
That
There's a lot
is,
of fear,
yeah,
lot of fear.
that's what Gary mentioned, that like a lot of media, lot of things, like I could see
Yes.
that in a social media, a lot of like hype was created about the quarantine and like 21 days, this and that. Like, see, sometime what happened, we, as you say, like surrender. There's a key word called surrender. If the universe going against certain way and it is not happening in
Soon.
your way, you just surrender yourself, you flow with it, right?
Well
uh,
said.
there's that nothing is going to change, like you just give some time. But if you try to fight with that, right, that's what tried people try to fight. Like, okay, fine, 21 days quarantine, I like, just like for the sake of argument, right? 21 days quarantine, you surrender for 21 days. 14 days quarantine, 14 days, you surrender 14 days. we live so long, 70, 80, 90 years, like people live. Out of that, 21 days is nothing. Just give your 21 days. That's where I think like the people have like really created a fiction that they said like, no, why should I sacrifice even one day of my life? So this is a lesson which universe gave to the mankind, that no, we need to learn the patience, we need to learn certain kind to surrender. And I think like that's my like very humble opinion to everyone, that this is a big message and lesson to learn.
Can I add something
Yes,
to
please.
this quarantine?
Yes.
If you have heard, I was the first person to come on the flight, rather my husband and myself and many more, on the flight that we were in quarantine in Bhutan. And for 14 days, you won't believe it. Morning, I had prayers and I put a lot of affirmation on my wall. Then I painted. Whole afternoon I painted, rested, and then I had a good evening with a prayer. And I took all the pictures and a video. If anybody wants to see it, I'll send it to you. That's how I spend my quarantine there. And in that quarantine group, there were 300 people. This is Poonam, can you send us a prayer every morning at 8:30? I send a prayer 8:30. Those people, now we are about 60 people in a group. I send them prayers every morning and they look forward to that. So Mr. Gary and Mr. Sanjay, and I think our Manohar has disappeared.
The Manohar is there.
Oh, he's there. Okay. Again, I really appreciate what you said. Think positive. I know it's very hard sometimes, especially when you lose your dear ones, but then nothing we can do, is nothing in our hands. The choice is ours to think positively and live a better life. That's our choice. Today, our choice is to ask more details about the treatment in our house. That's the first choice now I'm going to make tomorrow morning. And you will see all my family members will be taking advantage of the situation. And thank you very much, each one of you. Thank you.
Pleasure.
Thank you, Auntie Poonam. That was lovely. Yes, I mean, I hope the whole. Yes, Mr. Lal wants to say something. Did you want to unmute yourself? I heard you. It seems like you want to say something. Unmute yourself.
There is a question.
Yes.
Yeah. Yes, Mr. Lal.
Yes, I'm looking forward tomorrow. Maybe there is some announcement about traveling. I've been missing my traveling, you know.
You mean the quarantine to come down to 7 days? Yes, everyone's looking forward to that.
I hope so. There will be some, relief from tomorrow. So let's hope so. Good
Let's
luck.
always look for the positive. Yes, look forward
Yes,
to the
yes.
light at the end of the tunnel. Yes, there's a question up there. It says that my 72-year-old uncle is a cancer patient. His doctor strongly advised him not to take the vaccines. Thus, he has not been vaccinated. What is your personal advice in this situation?
Yeah, so there is a special arrangement, like it's very well known around the world. Those who are advised by their healthcare practitioner not to take vaccine, follow their healthcare advisor, because vaccine are having certain kind of side effects. So their doctors can tell them. So those who are at the high risk group of side effect of the vaccine, their doctor can advise them. So if um, uh, your uncle is told by your doctor, like his doctor, not to take vaccine, then yes, he has to avoid the vaccine, and he has to take like a much more hygiene precaution, working more on a immunity kind of things, increase the immunities. There's so many other way of managing vaccine, means high immunity and everything. And this is the provision. So I want to clarify one thing, like vaccine is never mandatory by the government for all the people. What is the definition of the mandatory? Like there is a room that there are so many people, they are not advisable to take vaccine, and doctors are giving them in writing the certification that yes, don't like this patient is not suitable for the vaccine, so they can carry those um, a note from the doctor, and then even can upload on your vaccine record kind of things, which is acceptable by the government. So if you are thinking like your uncle having a traveling problem or other kind of vaccine passport, what you are hearing a lot, note from the doctor is also considered the exemption in a vaccine. It's a valid things all around the world.
All right. So thank you so much. It is 9:15 p.m. Thank you for being here. Thank you for all the knowledge that you have been sharing, Dr. Sanjay. Thank you, Mr. Manohar, Auntie Poonam, Gary, for being here, sharing, and all those who have come here today, listened. I hope this has been an insightful and invaluable session for all of you. If you have any questions with regards to the disinfection, please contact Naveda, and we'll be more happy than ever to support you and serve you. All right.
Hello, can I say something?
Yes,
Yes.
please.
Yeah, actually, I'm Grace from Sarawak, Malaysia. Okay.
Yeah.
So what happened is the question was answered by doctor. Thank you so much. Yes, actually, for Malaysia now, Omicron, I think all over the world has been spreading like wildfire. But like I said, we should not panic because it's so common now. More and more people are actually contracting it, including my own sister-in-law. She's actually a homemaker and she has not been going out, and yet she has actually been affected by Omicron. So what's the reason for that actually?
Yeah. See, like the thing is, it's a different people have different immunity level. Okay, so obviously the infection is based on the immunity, and the thing is like in the Omicron, the good thing is what people saying, Omicron don't affect your lungs. It is like up to your throat or upper respiratory infection. So
I
that is why it is safe to have a Omicron, because it is not a lung infection, it is a upper respiratory infection. So therefore you have a lot of like throat pain, coughing, but you are not admitted in a hospital because you are not feeling the breathing problem or serious kind of thing. So one way people are feeling like this is a nice way to say goodbye to COVID through the Omicron variant. And on a very light note, even some people saying like those who don't get a Omicron, like let's get the Omicron and get over of it. So
Yeah,
I,
that's right.
I don't want to go into that line as a scientist, but these are the common thing, and it's not very serious. But it's a serious for the people. Any disease is a serious for the people, those who have a pre-health condition. So I would say like the pre-health condition, again repeat, senior people, pre-health condition people, and the children.
72. My husband was in Melbourne for 3 months and she just came home last Friday. So because he had his booster, so he was actually quarantined for 5 days. So 2 days before he was released, there's a PCR test and he was pressed a lot. He was negative. So he was released on Friday. As scheduled, 5 days. So when he was in Melbourne, he actually has Omicron, positive. So the whole family, my daughter, my son-in-law, and four kids, all of them were quarantined because somehow I don't know how my husband was contracted with Omicron, but upon arrival in Melbourne, he was okay. Praise the Lord, because he has to go for PCR test and it was negative, but it's only after a 1 month stay, then he actually was contracted with Omicron. So he didn't tell us. He didn't want us to worry. Only when he was home, then he said, you know what, the whole family was down with Omicron. So because of that, I would say Omicron is very safe.
Okay.
Correct.
What Gary said at the beginning, and what Poonamji has said, just remember, one way of dealing this virus is not to talk about it.
Correct.
Don't go to analyze this thing in detail. Okay, just be normal. I want to introduce you finally to all the people who are attending this. There's a new branch in science. We call it neuroplasticity. Neuroplasticity is a new science, like it's a power of our brain, like the way you think, the way you feel, your brain start adopting it. More you go negative, more you started thinking about the things, your brain is more into that particular side. If you stop talking about this virus, if you start talking about something good, like the brain adopt in that way. And it's well proved in science that the immune system is a lot to do with your mental condition also. So if your mind is like taking negative thoughts are negative, and then you try to boost your immune system, it doesn't work. Immune system like really compromise with the negative thoughts and like too much worries and all those kind of things. My final message to that, like it's a let's adopt the holistic science. Holistic science means like everyone has covered the whole point over here. Be positive, avoid unnecessary travel, avoid unnecessarily gathering, maintain personal hygiene. So I think like when Gary started, he actually pinpoint all the important point. That's it. Like, so I'm repeating like what Gary has said, like, and well said, Gary. Thank you very
I
much.
still have more points, but maybe we can do part two.
Yeah,
Yes,
definitely we can do part two, but like what you said is absolutely agree with you. And that's I think like if there is a people like you in this community, that's my final request, that please convey your view to the people around you, because that's what we need. We don't need the people like who are scaring the people, talking too much and like creating the panic and creating the sad stories. No, it's
and then
over.
bottom line is we have to stay positive. We
Yeah.
just have to stay positive. It's already an endemic. Our friends in Singapore and Norway, every twice a week, they have to actually do self-test before
No,
going to the
okay.
office.
I just wanted to tell you like that. That's what exactly I'm saying you, Grace. We are scientists. We are bombarded with data every day. Last 3 years, not even a single day, I'm dealing with like information, the type of information we have as a scientist. You have no idea what we gone through. So I will request you, please don't go into that. Don't analyze it. Like whatever happened. Forget about it. That's it. Today, if you are well, if you are everyone is okay, start your day today and onward today. Maintain your
Yes.
hygiene, maintain
Take
everything.
take
Don't
one
go into
day at a time. Basically, it's to take one day at a time.
yeah, means don't go
Save,
into the
save
past,
your
otherwise.
energy and
Yeah,
think how to
yeah,
deal with the coming up problems.
yes, exactly. Because the thing is that as Gary said, like we should do the session two, because there's so many interesting information which I feel people should know. Because again, Veena knows about it, and I told Veena like, okay, Hong Kong is going to happen like that, and no one was listening, and it meant to happen. So nothing magic happened in Hong Kong. It was like it's a calculation. It's supposed to be like that. That's the nature. What we need to be prepared, that this is my concluding remark. uh, COVID is not like a one time and it's gone and then we start enjoying like that. It's like an earthquake. It can come again, some different virus. So this is the lesson to learn how to prevent, how to take care. But if you do well, you prepare from some other pandemic if it is on the way. You never know, because it is always there. So let's have some another session where I give little bit of historical background, because what people need to understand, this is nothing new happen. It's always keep happening. Last 20 years, we have a lot of this. The question is like you don't know. That's why you're not affected. That is why you don't talk. But we scientists, we know that there is not a single day in last 20 years when we were out of any kind of like viral infection, is one of the very big thing. So, and in my Facebook post, I would like add this. This is very interesting. In my Facebook in 2011, I talked about COVID. I knew that it's coming, but I didn't know when it was coming. So that's what it is. So it is on my Facebook post. Like in one of the hospital in Taiwan, I gave my lecture, right? So in our community, we know many things are coming. We only don't know when it is coming. Okay, that's it. That's how it is. So the main thing is is precautions, right? Not to get panic, not to get afraid, right? So that's how I absolutely, here I would say, like, absolute salute to Gary. Like, I will go with Gary's word to word, because he summarized everything, and my concluding remark here is, please follow what Gary has said. Okay, thank you very much.
Thank you.
Okay, thank you so much. Good night.
I have, Veena, one line to say.
Good night.
Everyone, please understand and do only good things for yourself, your family first, because world is not important for you today. You are the world for your family. So
Yes,
make sure you are safe, you are alive. Nobody's going to take care after you're gone. So
yes,
please be good, do
yes.
meditation. God bless you all. Thank you.
Thank you very much.
Okay,
Be
thank you.
positive.
And good
Be
night.
positive.
Yeah.
Be positive. Thank
Thank you,
you.
everybody.
Bye.
Thank you.
Thanks.
Thank you. Good night.
Bye.
Bye.
Thank you, doctor.